19.5% of our troops will return with a traumatic brain injury. That is hundreds of thousands of young men and women. The burns, the orthopedic injuries, the spinal cords. In your community, in Columbus, in the non-military community in Columbus, you had 45 spinal cord injuries in 2008. You have between 40 and 50 a year in your community, in the 4 counties surrounding Columbus, that are non-military injuries. The lifetime health care cost for each of those people is $75 million. Every year in Columbus, Georgia, you are having a $75 million health care cost with the people that are injured with spinal cord injury alone. In the United States, every 21 seconds, someone has a traumatic brain injury. More people die of traumatic brain injury than of HIV/AIDS and breast cancer every year. It is a $50 billion annual cost to our healthcare system. There are 1,000 neurologically related injuries, diseases, and disorders in the United States that cost $500 billion every year. It's the 3rd leading cause of death in the United States, the 2nd largest leading cause of death worldwide. So it's not a trivial issue. We already own burns in Augusta, Georgia. We have the opportunity to own neurotrauma. I'm going to be meeting with Bernie Marcus on October 5th. He has donated over $100 million to Grady, Shepherd, Georgia Tech, Emory. In fact, it's over $150 million in neurotrauma. It has given us the opportunity to be the national leader in neurotrauma. And what we want to do is build a rehab facility that is the state of the art. There is no reason why 25 centers in China should have 50% of their patients who have injuries like David has or like I have walking again, when less than 1% of those patients are walking again in the United States. That is simply unacceptable. For someone like me, who I have had every advantage and blessing that I could possibly have in life. I've traveled the world. I've done everything I want to do professionally. I have a wonderful family, dear friends. I'm able to do things that have meaning for me in making contribution in nonprofit and other areas. I've lived a full life. But for an 18 or 19-year-old man or woman who picked up a rifle to go protect our freedom in Iraq and Afghanistan, who's going to spend the rest of their life in a wheelchair unnecessarily, that's unacceptable. And it doesn't have to be the standard of care. And I want to change that standard of care, and we have the opportunity and the resources in our state to do that. So what we want to do is create a rehab center where we're partnering with these wonderful people in research. It's SJTRI at their Phase 1 unit, with Georgia Tech, with Emory, we hope with Grady, with the MS Center, we hope with Children's, where we have the state-of-the-art rehab facility where we can change the outcomes of these young men and women, of children, of our geriatric population that suffer from stroke. And we have the opportunity to do that. Let me go through a bit of, I've covered a lot of it. Sanjay Gupta was my surgeon at Grady. Wonderful. He recently was on, he has a show, Sanjay Gupta MD or something. He had a guest on that show named Dean Kamen, who's one of the most prolific inventors in the United States. He invented the dialysis machine, he's invented helicopters, all kinds of things. And the DARPA approached him about prosthetic limbs. They said, you know, we've got this clunky piece of plastic. This isn't working. We want you to come up with something that has the functionality, wrist, fingers, shoulder, elbow, of a normal arm. So he spent 17 months, and Sanjay had a double amputee, both arms that he had lost, on his show. And the guy walks in, and he's got this iRobot-looking clear plastic arm. He shakes his hand. He picks up and eats a grape. He grabs a Coca-Cola, which I know Mr. Turner will be glad to hear, from up above his shoulder, and pops it open and drinks it. And he's operating it from his foot, underneath his foot. And Dean Kamen, you know, talked about meeting with amputees from the United States military. There was a table full of them. And one young man at the end, he was talking about this, and he was trying to test it, and see what they thought of this new device. And everybody was chiming in. And there's this young man at the end of the table who wasn't saying anything, and he had his right arm amputated. And they waited till the end of the conversation. And he said, "Why didn't you say anything? Do you have any comments? What do you think of what we're doing?" And he said, "Well, I was one of the lucky ones. I was left-handed before my injury, so I still have my primary arm. I'm able to write and do what I want to do functionally. And so I think what you're doing is great, and I think it's going to help a lot of people. But I fortunately still have my primary arm, and so I've been very blessed." So they finished the whole meeting, and the young man, who's 22 years old, pushes himself away from the table, and he has no legs. And that's the kind of sacrifice that these young men and women are making on the front lines. And I mean, just the psychological impact of, I'm never going to be married, I'm never going to have a family, I may never work again. What am I going to do about my... They don't talk about that. They talk about, oh, I got nicked. Oh, I'm so fortunate. I'm so blessed. It was other people who made the sacrifice, who were so brave, who stepped forward. They deserve the very best that we have to offer as a society. There are changes happening in healthcare today that are going to revolutionize how we treat. Jeff and I were I'm so frustrated. We looked 2 years ago at a company that produces islet cells to cure diabetes. That company, which was worth $6 million 2 years ago, sold for $350 million earlier this week. We were trying to recruit that company to Georgia. The day that I was injured, I was meeting with Bob Langer, who's one of the most, talking about his company and recruiting it to Georgia, which is one of the most prolific scientists in the United States. He's about to pass Thomas Edison as the #1 patent holder in our history. He's the only person alive on the Academy of Science, Medicine, and Engineering at the same time. He's a billionaire, basically. He has 120 MDs, PhDs working in his labs at Harvard and MIT. He created a company that they paralyzed a monkey surgically from the waist down. They had it walking 2 weeks later, running and wagging its tail 5 weeks after that. He did the clinical trials in the Caribbean because he couldn't do them in the U.S., but he wanted to move his company to Georgia. He wanted to do his primate trials at Yerkes, which he considered to be the world's leading primate center, and he wanted to do his clinical trials at the Shepherd Center, which there are 14 hospitals in the central nervous space in America. Shepherd's the only one that does clinical trials that has an intensive care unit. He wanted to move his company to Georgia that had that kind of which really helped me to understand really what an advantage we have in neurotrauma. This guy from Harvard and MIT wanted to do that. Unfortunately, they became the centerpiece of the billion-dollar life science center in Boston. I tried to recruit them to Georgia, and when we announced our $400,000 Global Center for Medical Innovation at our last summer at our bio conference where we hosted the world in Georgia, we made a $400,000 commitment. One state after another within that 2-week period was making multi-billion-dollar commitments. $3 billion in California for stem cells with my friend Roman Reed, who has my injury. $3 billion in Texas for cancer. $1 billion in Minnesota from a single individual for a life science center. $1 billion in Maryland. $1 billion in Massachusetts. It's illegal for us in Georgia to invest our pension funds in alternative investments. Florida, and this is all within 2 weeks of our bio conference when we announced our $400,000 initiative. Florida invests $950 million in health innovation. Tennessee and Florida $350 million. We simply cannot compete not only with California and Massachusetts, but with Tennessee, with Texas, with Florida, with North Carolina, if we don't step forward and start to make an investment and a commitment in health innovation. We have the resources, we have the infrastructure. On November 13th, I'm going to be presenting, and I'm not going to go through the whole thing, but this vision of health innovation and regenerative medicine for our state to our governor and new legislature. As Kelly mentioned, we've been meeting with business leaders across the state, philanthropists across the state to do this. Bill Gates and Warren Buffett have announced a $600 billion initiative for billionaires across the world to give away half their net worth during their lifetime. Ted Turner's committed to do it. Bernie Marcus is committed to do it. We need to brand our state in venture philanthropy and bring those people to us with the CDC here, with the unique military population we have. Fort Gordon is not only the Warrior Transition Battalion for the nation, the largest spinal cord injury burn center, they have the largest communications hub in the world. In the world. There are 280 orthopedic surgeons in the United States Army. 80% of their injuries are orthopedic in nature. We are going to be driving solutions in telemedicine, and we have the opportunity to do that through our healthcare infrastructure in Georgia. I was meeting with the leadership of your Columbus Memorial or Hospital yesterday to talk about how we can do that through Fort Benning. We need to step up and lead in that area, and we need to reach out to these billionaires that are going to be making this gift and show them that we are going to be the next generation of health innovation in this country and around the world. I mentioned the Pritzker family earlier. They've got a $20 billion net worth in Chicago, yet they're moving their investments in medical device and regenerative medicine to Georgia. They're making a $750 million commitment. We need to step forward as a community and take advantage of that. We need to take advantage of what's happening at Georgia Tech and Emory, which have the #2 biomedical engineering program in the United States. And the SJTRI, which is a $30 million research area. I've already mentioned that we've got so much infrastructure and opportunity with your, with what you're doing in your community, with Warm Springs, with Fort Benning. We can use this kind of technology to link these efforts together to bring cutting-edge rehab, cutting-edge technologies into our healthcare population. And we're here because we want to reach out to the Columbus community and partner with you to do that. Can I go to the next slide?
Sure.
I basically went through the whole thing. I'm not going to go through the problems of the U.S. healthcare system.
You've done
I talked to you guys about the $75 million impact every single year just in spinal cord injury alone in the civilian population in the 4 counties surrounding Columbus. Go ahead. This is what we have got to change in our state if we do want to be a leader. We've got to change our technology transfer. We have some of the most challenging difficult technology transfer. That's your tax dollars and mine doing research at Emory, Georgia Tech, MCG, our schools. The way Stanford looks at technology transfer, or MIT, they know they're going to get money back from donors. They're not worried about making money by owning businesses. We need to change that in Georgia, and we will. We need to link our hospital systems together. We are one of only 2 states in the nation that was funded for the past 10 years in the Coverdell Stroke Registry. That has already connected 60 of our hospitals across our state. There are 157 hospitals in Georgia. 60 of them are already connected. We need to fund the Coverdell-Murphy Act so we connect the rest of our hospitals. We would be the first state in the nation to have all of our hospitals connected in telemedicine. That is under our responsibility at DCH. As chairman of that board, I'm going to do everything I can to make that happen. Pension reform, we're the only state in America that does not allow our pensions to do alternative investments. It is absolutely destroying our economy in Georgia. I testified in 2006 before the legislature. I brought one of my friends in venture capital. He said to the State Senate Retirement Committee, I have 7 portfolio companies left that are located in Georgia, I did, that had $1 billion in aggregate revenue. They've all left the state in the last 6 months because of our pension reform law, our pension laws. And now, since that testimony, he's left the state. He was one of the most successful medical device companies in the country. Branding. Jim Clifton, the CEO of Gallup, said that there was asked the question, how many entrepreneurs does it take to drive the U.S. economy? Arguably the most powerful, successful entrepreneurial economy in the history of the world, with 310 million people, how many innovators does it take to drive our economy? How many Bill Gates? How many Warren Buffetts? How many Ted Turners? How many Woodruffs? The answer was 3,000. So there are 3,000 innovators in our society that are driving our economy. The question we need to ask ourselves as Georgians is, how do we attract the largest number of those 3,000 people? And we're not going to do it if we don't create a business-friendly environment where we're branded and focused as a state and where we have our pension laws that are working and tax laws that are attracting those people. The military is our key competitive advantage.